Does your ear hurt? Interesting about science and medicine prepared by editors of a channel of Scientifical. How do you cope with ear pain? Due to proximity of a ear to the brain, pain in this area of the body is especially difficult for the patient to bear. Of course, in many cases, pain can occur as a result of minor disorders that are very easy to treat. In more serious cases, you cannot do without the help of a doctor. Reason 1. Excess hardened earwax. As a result of accumulation and hardening of earwax, the eardrum is blocked. Symptoms of excess earwax: ear pain that increases over weeks or months, partial hearing loss, a feeling of blocked ears and ringing in the ears. What can be done? Add a few drops of warm baby oil or mineral oil to the ear for 3 days in a row to soften the earwax. Then use an enema to clean the ear with warm water. Other feature: a jet of water directly into the ear can cause dizziness. Caution: never try to remove hardened earwax with any object, even with a cotton swab, which can damage the eardrum. Cause 2. Ear barotrauma. Ear barotrauma occurs as a result of damage of the eardrum due to large fluctuation in atmospheric pressure. Signs of ear barotrauma: ear pain as a result of flying with an airplane or after diving, which can radiate to the forehead and cheeks. A feeling of blocked ears, ringing in the ears. What can be done? The symptoms of this disorder should disappear within a few hours without any specific treatment. If the pain does not disappear within a few hours, you should see a doctor. Other features: during the flight, it's recommended to hold your nose and inhale slowly and constantly, chew gum or hard candy. The fact is that in this way you can normalize the pressure on both sides of eardrum. Reason 3. Presence of foreign body in the ear. The penetration of foreign body insect gland or ear plug can cause ear pain. Signs of the presence of a foreign body in the ear: ear pain, hearing loss, feeling of a foreign body in the ear. What can be done? Never try to remove a foreign body from the ear yourself. The fact is that in this way you risk damaging the eardrum. Be sure to see a doctor. Cause 4. Swimming ear. Symptom of swimming ear: itching the ear, which after a while turn into sharp or dull pain, fever sometimes, temporary hearing loss sometimes, yellowish discharge. Pain intensify if you pull on the earlobe. What can be done? Take paracetamol to relieve pain. Your doctor may prescribe ear drops containing antibiotics, cortisone to reduce inflammation, antifungal drugs. Other feature: try to avoid getting water in your ears, for example during a shower or swimming, for 3 weeks after the disappearance of a sign of a disease. Do not use earplug, they can cause injury to the eardrum. Cause 5. Otitis media. Symptoms of otitis media: hearing loss, nasal congestion, sudden and sharp ear pain, in some cases, a throbbing and dull edge. What can you do? Put a warm compress on the ear and take paracetamol. Consult your doctor, he may prescribe an antibiotic. Other feature: a few drops of warm olive or mineral oil in the ear can relieve the pain. Reason 6. Cyst or benign tumor in the ear canal. Signs of a cyst in the ear canal: hearing loss, sometimes infection, sometimes fever, swelling, ear pain, excess earwax, lump in the ear canal, feeling of pressure in the ear. What can be done? Often the cases do not require treatment, but still, if the cyst or tumor become too large or an infection is noticed, then the doctor will remove it. Reason 7. tooth or gum disorder. Ear pain can be a result of tooth or gum problem. Temporomandibular joint syndrome, tooth abscess, tooth decay. What can be done? Contact your doctor as soon as possible. A tooth abscess in emergency health issue. Other feature, relaxation technique can help calm mild cases of temporomandibular joint syndrome. Cause 8. Mastoiditis. Mastoiditis is an infection inflammation of a mucous lining of a cave, antrum, and the honeycomb structure of a mastoid process of a temporal bone, which is located behind the ear. Symptoms of mastoiditis: partial hearing loss sometimes, thick pus from the ear, slight increase in body temperature, redness and swelling in front of behind the ear, a dull edge. What can be done? Seek immediate medical help. Treatment of a disorder requires strong course of antibiotics, sometimes lasting more than a few weeks. Persistent infection might require surgery to remove a source of infection. Reason 9. Rupture eardrum. Signs of rupture eardrum: partial hearing loss, tinnitus, dizziness, bleeding or drainage of pus from the ear, sudden pain in the ear, usually associated with injury or infection. What can be done? Take paracetamol to relieve pain until you see a doctor. You may need an eardrum patch to speed up healing and antibiotics. A ruptured eardrum can be repaired with surgery. Do not blow your nose or allow air into ear until your eardrum has fully healed. This may take up to 2 months. Thank you for your attention. This material was prepared by editors of a page All Scientific. Attention, this material is for information purposes only. When observing very unusual symptoms, it is recommended to consult a doctor. Subscribe to our channel. Thank you. Bye bye.